Hi, I'm Daniel Nassar, and in this supplemental video, we'll cover ureter and uterosacral ligament assessment on transvaginal ultrasound. Both of these advanced gynecologic ultrasound skills, if added to your arsenal, are sure to enhance your diagnostic capabilities in ways that are not available to most patients. Let's start with identifying the ureter. Identifying the ureter on transvaginal ultrasound is actually quite easy once you know the steps. To start with identification, bring the ultrasound probe to the anterior fornix, with the uterus in a mid-sagittal position. From here, sweep the probe laterally without any rotation until you're almost at your maximum lateral sweep. From there, a bit of rotation with the probe or with the steering or tilt function on your ultrasound will help to get the entire length of the ureter in view. It's important not to rotate early because if you do, you'll totally lose the potential view. And if you get lost, just restart these steps. Go back to the anterior fornix with the uterus in mid-sagittal and start over. Let's take a look step by step with an example. So here we have the probe in the anterior fornix with the bladder in yellow and the uterus highlighted in pink. Now as we start the lateral sweep, I'm imagining this red line in the middle of the screen, and I try to keep my bladder totally to the left of it. And as I sweep laterally, I start to see the ureter come into view at the very top of the screen by the bladder. And now that I see that it's there, I rotate the probe very slightly. And in this case, the entire ureter comes into view. The vermiculation, as you see right there, is a nice thing to see if you're patient enough. And that lets us know that we've seen the entire ureter, and it actually can be traced more proximally if you follow it along with its motion. In this next example, we see the entire course of the ureter once again with some vermiculation. And in this example, we see the uterine artery in this classic water under the bridge surgical depiction, but now on ultrasound. In this example, we see a rather large ovarian cyst neighboring the ureter. And this just is a way to show how important it is to assess for the ureter in cases of gynecologic pathologies, in which case compression of the ureter or even intrinsic endometriosis can be present. And if you do find a ureter that is more than 6 millimeters dilated, it's important to follow that up with a renal ultrasound to assess for kidney impairment. Moving on to uterosacral ligament identification, we'll have our home position in this case be the ultrasound starting in the posterior fornix with the cervix in a mid-sagittal position. And if you get lost at any point during these steps, just go back to that exact home position, mid-sagittal cervix, posterior fornix. And from here, I'm going to focus in on the thin hyperechoic line of the posterior peritoneum, and then sweeping laterally with slight rotation at the same time. As you watch your focus on that thin hyperechoic line of the peritoneum, it should thicken out into the uterosacral ligaments. Once you identify the uterosacral ligament from there, a sweep medial to lateral through the whole ligament will show you if there's any pathology there. Again, let's walk through an example. So here we're starting with the ultrasound in the posterior fornix, and I see the hyperechoic line of the posterior cul-de-sac peritoneum. As I move the probe laterally and sweep in the same direction as I'm assessing, I see that thin line thickens out into the uterosacral ligament. Another example here with a small amount of free fluid helps to highlight the thin line of the peritoneum, and with a lateral sweep and rotation, it thickens into the uterosacral ligament. In this example, we have even more free fluid, which helps us to give contrast and see. Starting with the thin hyperechoic line of the posterior cul-de-sac peritoneum, sweep laterally and rotate until that thin line thickens into the uterosacral ligament. In this final example, we see a lesion on the uterosacral ligament, which will appear as a hypoechoic disruption of the hyperechoic uterosacral ligament. I sweep medial to lateral to identify the full extent of the lesion, and once I see it, I will measure it in longitudinal and transverse planes to characterize it and to make sure that it's not a blood vessel that I'm mistaking for a endometriosis lesion. Thanks for watching. Hope you learned something, and I'm looking forward to seeing everyone at the course.